Facelift or fillers. I am going to be 48 in a few weeks, and I have been considering a facelift for a few years now. My goal is to be proactive and have the procedure done before there is too much sagging. I'm not looking for a huge transformation. I would rather people just notice that I look younger, not say immediately, "Oh, did you have a facelift?" I have had fillers and fat grafts, and I am not achieving the lift and/or fullness in the lower face that I am looking for.
Thank you for your question. You've submitted a single photo of the full face and front view, and you're stating that you're going to be 48 in a few weeks, and your narrative is really very good. You're describing how you want to do something before you quote that is too much sagging, and you've had some volume correction, and you're seeing that you're hitting a limit with them. So I'm a board-certified cosmetic surgeon. I specialize in facelifting surgery as well as cosmetic oculofacial plastic surgery, the eyelids and the face related to the eyes. I do a lot of facelifts, and I have made a lot of observations as to the timing based on when people come in with common concerns. And I wrote a book about facial aging and looking natural. And I explained that the idea of determining what the right procedure for you is based on your unique facial aging process. There are two things that happen with facial aging. One is volumetric loss. That means loss of bone, muscle, fat, soft tissue. This means things go inward. We lose actual volume. That's why there's a phase in one's life where volume correction can be very effective. And it tends to be in the 30s to early 40s, depending on genetics. The other part of facial aging is sagging and descent. And this is where restoration of the physical position of descending and sagging soft tissue is so important. And you've made a very good judgment about your limit of how much filler is benefiting you and why it's reaching a limit. You see, when the soft tissue, and when I talk about that, I'm talking about the skin and the tissue under the skin that is an intermediary between the muscles of the face, the movement, and the skin, called a SMAS, or superficial musculoaponeurotic system. When this tissue sags, it becomes frustrating for patients to have filler because the envelope, or the support isn't there, and the fillers just kind of get lost. So a facelifting procedure is probably going to be beneficial to you. In the absence of typical views that we like to see in determining what type of facelifting procedure, which is a side view, because with a side view you can see the descent of the jowls, you can see the neck, and you can get a sense, even with photos, of a certain type of facelift or face and neck lift. It's important as you make your determination that you'll see a lot of marketing related to facelifts. There are facelifts with particular brand names. There are different surgeons who offer one type of facelift, such as a deep plane facelift. It's with the assumption or they're trying to suggest that they're the only ones who do that procedure, which is not true. Anyone who does a lot of facelifting surgery is very well aware of the customization of facelifting. And some of that customization occurs when you're under the skin and you're actually, as the surgeon, determining what's the best way to lift the soft tissue. But the key element is to do something with the SMAS. This includes various things such as SMAS flap, high SMAS, and SMAS plications and things like that, or deep plane facelifting. But much of this is also about the artistic vision of the surgeon. And that's where making your decision is so important. You and the surgeon have to have a convergence and a meeting of the minds as to what outcome you desire. When I see patients who are referred who are unhappy with their facelifting surgery, a lot of times it's not necessarily a technical issue from the on the surgeon's part, but rather a miscommunication between the expectation of the patient and the doctor. So a good thorough consultation. When we see our patients in our practice, we spend a lot of time with our patients. I will evaluate, I'll show them before and after pictures, and they'll see what my style is. And for us, it's more about natural and retaining that look. Like as you described, you don't want to be seen as somebody who's had a facelift, and I think that's a very healthy outlook on what you want your surgeon to do for you, is to look as if you're well rested, and for no one to be able to tell that you had something done. Essentially, to move back the clock several years back so it just looks like you, just a younger version of you. The way the facelifting procedure is done is also important in terms of anesthesia. I'm of the opinion that local anesthesia with sedation allows me to have better control over the appearance as opposed to general anesthesia where there's a tube in the throat and the mouth is open and the face is totally paralyzed, not to mention the healing process. And that's a personal perspective. It isn't in any way disparaging anyone else who does general anesthesia. But in our practice, this has been very, very successful for us. We're able to, our patients always comment on how quickly they recover. And it's not because we're doing any shortcut procedures. We're doing full, extensive face and neck lift, platysmaplasty, sometimes combined with cheek implants, chin implants, no shortcuts. But at the same time, sedation, the method of anesthesia, does play a very good role in the recovery process. So I think meeting with doctors who perform facelifting surgery, and there are many who do, and so you have a lot of options, and getting a sense of the aesthetic style and the way they do things, and meeting the staff and getting a sense of what they feel about the doctor's work, I think you're going to find yourself being, once you meet the right doctor for you, that a lift will give you the structure and definition. If you think about it, facelifting the goal is to lift the cheek, improve the jawline, improve the neck. And if that's your goal, then I think you'll be very happy with the restoration of your facial balance. And then you can add volume and be much more strategic and get a nice combination effect when that time is right. Remember, a facelift is not a substitute for volume correction. There's a synergy because you're dealing with two issues. You're dealing with descent and volume loss. So I hope that was helpful. I wish you the best of luck, and thank you for your question.